Hello and welcome to our overview of Lesson 4 of the CCVR course. Today we're focusing on a critical aspect of vestibular rehabilitation, peripheral vestibular diagnostics and medical management. I think the why we delve into common and even less common vestibular disorders is pretty apparent. An accurate diagnosis is the cornerstone of effective treatment, and understanding the pathophysiology and optimal medical management of vestibular-related disorders is key to improving patient outcomes. Again, an accurate diagnosis is paramount. Without a clear understanding of the underlying causes, it can be more difficult to effectively treat vestibular-related disorders. A proper diagnosis enables us to identify the specific pathophysiology at play, guiding us toward the most appropriate medical management strategies. This ensures that our interventions are targeted and effective, paving the way for successful patient recovery. Unfortunately, far too many patients do not have an accurate diagnosis. This delays their recovery and can result in secondary physical, mental, and financial consequences. We also need to recognize the challenges patients face in receiving an accurate diagnosis. Vestibular disorders are often complex and multifaceted, often requiring a combination of diagnostic tools and clinical insights. It also entails clinical reasoning skills for accurate differential diagnosis, and that requires a comprehensive intake and review of past medical history and other confounding factors. And this requires spending adequate time with patients for the interview process. We also talk about pharmaceutical management options. When it comes to medications, there are several options available to address vestibular symptoms. Medications can help manage vertigo, nausea, and other related symptoms, providing relief and improving someone's quality of life. However, many of these medications may hinder their recovery process, yet others help stabilize the vestibular system. You'll also learn how some medications may be administered to actually destroy the function of the inner ear. Pharmaceutical management is a complex process, especially including drug interactions, and that most medications cause dizziness, even those for dizziness. Now, the CCVR course isn't knowing about all the medications or prescribing medication, but being aware of the effects and what medications are used to stabilize the ear, and how some medications are toxic to the inner ear and even used to ablate the inner ear. It's also important for us to know when vestibular rehab is appropriate and when it's not. I think we all agree vestibular rehab is a powerful tool, but it's essential to know when it's suitable for each patient. Not all vestibular conditions benefit from rehab, and understanding the indications and contraindications is vital. Vestibular rehab is more than just VRT exercises. It requires consideration of overall lifestyle and comorbidities that may affect outcomes: sleep, diet, exercise, mental health or mental illness, as well as having an understanding of the other sensory systems, the neck, the central nervous system, and the autonomic nervous system. If you've been treating vestibular patients, you know that all of these can play a factor. In addition to medical and vestibular rehab therapies, there are other complementary therapies, and they can play a significant role in managing vestibular disorders. This may be acupuncture, craniosacral therapy, cognitive behavioral therapy, talk therapy, manual therapy, and other options. Identifying and addressing the psychological components that often accompany these conditions is crucial. Anxiety, depression, and stress can exacerbate vestibular systems, creating a vicious cycle. Integrating psychological support, mindfulness practices, and other complementary therapies can enhance the overall treatment plan, leading to better patient outcomes. So thank you for joining me in this lesson. I hope you join me in the next video on Lesson 5, where we take a close look at the variety of central vestibular-related diagnoses in medical management.